shirt too.
I guess I don't believe it.
Ladies and gentlemen, it's noon. I want to call this meeting to order. Thank you all. Let's go to the agenda. Would you, you you've already taken roll of the three of us. And we're the only board members, it looks like, that are that are participating today. I would entertain a motion to approve the agenda.
Sure, I move to approve the agenda. I second.
Thank you. No objections. The agenda is approved. Do we have any public participation? I don't see any online or in the room. Well, I would entertain a motion to approve the minutes.
Madam Chair, I've reviewed the minutes and I'm confused.
Thank you. No other objections, so the minutes are approved as presented. Let's start off with old business, the ED renovation update.
Thank you, Madam Chair. I wanted to give the planning committee a quick specific update on the ED renovation project. It's obviously something that we track on our monthly project updates, but there's been some new activity that I wanted to bring specifically to the committee's attention. So we have achieved the 35% design drawings and supplemental documents. And we're right now in the process of providing and then reviewing those comments as a project team. So we haven't gotten through all those comments yet, but we did provide comments and are getting those reviewed by the designers. Another thing is with the federal funding that we got through the congressional directed spending through Senator Murkowski's office, there are some additional requirements that must be adhered to, and these would include things like federal environmental, historic preservation, procurement and contracting, and material sourcing regulations. And because these will likely impact the administrative burden of the project, there could be additional overhead, additional time associated with these, and they'll likely carry some additional, not significant, but additional costs. I wanted to take the time to discuss what those things might look like with the board and answer as many questions as we can with the information that we do have. So with that, I have asked Jean to participate in today's meeting and give us some information on that. She's been actively tracking and managing these requirements on the Bartlett side. Noel Durst, our grants manager, and I have also been involved, just making sure that we're keeping good communication and to the extent possible, interacting with HRSA. That's the entity where this money will be directly flowing through so that we can meet those federal requirements and meet the requirements that they have for us to document what it is that we're doing. So Jean, if you're comfortable taking it on now and just kind of sharing some of the specifics, I'd appreciate it.
Sure. Thanks, Nate. Yeah. So one thing with congressionally directed spending is when you ask for it, you're not sure where it's going to come from and what requirements will be put on it. And so we're learning that now. And though we've been approved for $4 million, then we now have to apply for it through the Health Resources and Services Administration, as Nate just mentioned. So one thing that we've learned, there's several requirements that come with the federal funding. We have to comply with NEPA, the National Environmental Policy Act, and the National Historic Preservation Act, which we'll have to work through the State Office of Historic Preservation for that, and also the tribal office as well. So we need to prepare some preliminary information for those two items by the June 12th application deadline. So we've asked Architects Alaska to give us a fee proposal for that work. Let's see. The other piece with the NEPA specifically and the historic preservation piece is there's public notice requirements with those efforts. and in the grant information, it said, even if it's determined that we don't need to do a full environmental impact assessment, the minimum time to get through NEPA is going to be 6 months. If we have to do a full environmental impact assessment with the public notification period, it could take up to 12 months. So I think we could still be okay with the project schedule, our goal is to break ground in spring of 2025. But we really want to get on that quickly and get the process moving. The other requirement we have to meet is the Build America, Buy America Act. So that means that could be an impact on where we source the steel, and that could potentially impact the construction schedule once we're at that point. Not to mention that's going to require additional documentation by the contractor as well. And then the other thing that we're trying to get a handle on is the MWBE requirements, which is the minority and women-owned business outreach that's required on federal projects. And we need to determine what that MWBE goal is for the project. Oftentimes states will have a department that manages this. Alaska does not. And then it's my limited understanding of how it works is then the agency makes a determination, meaning Bartlett. I know the airport has a determination that they use for their federal funding. So does Capital Transit. So Noel, your grants person, has reached out to the grant administrator to get more information on how that determination is made. So yeah, that's the big takeaways from the impacts of this funding. Any questions?
Well, maybe it's an unanswerable question, but I'm a little bit familiar with the NEPA process for building a virgin, wilderness or something. But is this going to, what actually is briefly is involved with something like this, where there's already structures and?
Yeah. So so the way it is we're going to have to demonstrate that I don't think the project will necessitate a full environmental impact analysis, but it says all projects have to submit. We have to submit a preliminary checklist, and hopefully their review of the preliminary checklist will demonstrate that we don't need to do the full assessment, and then we'd be subject to the shorter 6-month time frame. But yes, it is similar to, we have to demonstrate that we're moving less than the cubic yard of native soil, etc. So, given that this project is, the addition is very limited and the site has been developed, I don't anticipate that we'll have to go through the full environmental impact analysis, but we still have to go through the process and have the federal government make that determination.
Thank you.
Mm-hmm.
Any other questions from either of you? This shouldn't be a surprise to any of us when you receive federal funding. There are a lot of, depending on the agency that you receive a grant from, there's always a lot of specific requirements. Unfortunately, it does delay the process, and it does make it in general a little more expensive. Nate, anything else about the ED update? And we're moving forward with the 65%, is that correct?
Through the chair, we just completed the initial 35% a design threshold from the architects, but that also includes an opportunity for Bartlett and the city to review and provide comments on that. So we completed that, I think last Friday was the review. There's still gonna be some comments coming through, but we got that initial set of comments back then. Architects of Alaska will now take the time to either incorporate those or generate additional discussion points for us to talk about with some of that stuff. I do want to say, even with the 6-month timeline here, we have consultation that has to happen with either the state or the federal government for some of these things, but that doesn't mean we can't continue to move the design process forward. So as Gene had mentioned, especially if we don't have to meet the higher environmental impact analysis threshold, we're not anticipating that component's gonna impact our construction schedule, if you will. We
Sure.
haven't got update on, oh, go ahead, Gene.
Through the chair, I just, excuse me, Nate, I wanted to add that we have started the selection process for the CMAR. And the statements of qualifications were due May 1st, but we pushed that out to May 9th to give us an opportunity to try to flush out the MWBE requirements, because that could impact the selection process for CMAR. But the other piece I wanted to mention about moving forward to 65% design, we have asked the design team to hold until the CMAR is on board so that we maximize the benefit of having the contractor on early to give us input for value engineering, project phasing, et cetera, during the design phase. And that the intent of that is to minimize any rework that would need to be done if we let Architects Alaska proceed further than 35% at this point.
Thank you for that. That makes sense.
Thank you.
And the only other thing through the chair that we're anticipating, hopefully within the next month and a half, is more information about the Denali Commission grant application. So I think last year we got it in July, maybe early July timeframe. So as soon as we get additional information, we'll pass that along. But that's the update on that project, unless there's any other questions.
Okay, so we should expect over the next couple of months to hear more about the federal requirements and what's going to be expected of us over time.
Yes.
Okay. Thank you. Ms. Wren, Jean, would you tell us, give us the project updates?
Sure. Thank you. So both chiller number 2 and the CT scanner projects are moving into the closeout phase, into the warranty phase. Also, same with the underground fuel line replacement project. The ground floor asbestos abatement project, we just got the 35% estimate. And so we're continuing forward with that. We're hoping to get that out to bid in the fall, because most of the work is interior, so it'll be a good winter project for a contractor. We completed the selection process for the life safety condition assessment for Wildflower Court and are negotiating a fee proposal with Northwind Architects. And let's see, Northwind Architects was also selected to do a feasibility assessment for the relocating the oncology program to the Juneau Medical Center. And we're also getting a consultant on board to deal with a fuel tank installation at Wildflower Court. So that's about it. Any questions?
Do either of you have any questions?
No, thank you.
Thank you for that.
You're welcome. Thank you.
Okay, next up, flipping right along, the facilities master plan. Nate, would you?
Thank you, Madam Chair. If you recall, last planning committee meeting, we started to talk a little bit about where we were relative to our planned, larger scale infrastructure projects, physical infrastructure projects. relative to the master plan. And so for today, I hope you've had a chance to go through your packets. I'm happy to make the entire facility master plan available to anyone that wants it. We've got electronic copies of it. But what I did is I actually went through and took some of the charts from the projects that were originally prioritized in the master plan and kind of just gave an update. And Anita, if you could kind of zoom and just keep the left side of the screen, the active side, if there's any way to scroll in on that a little bit more.
Go a little bit lower.
I just want to see it, but we've made quite a bit of progress since 2021 on the projects that were otherwise had been prioritized or were actively in design at that stage. But if you look, we've canceled a couple projects since those were prioritized, one of them being the physician call room. We started to get cost information on that back in the summer of 2022, and the cost was exorbitant. If I recall, it was on the order of something like $300,000 for a relatively minor impact. And so we decided to cancel that project. Also at that time, we had prioritized the purchase of what is now the search building down the hill because that one, they were able to act on that before we were. So that became an impossibility for us. Otherwise, we've completed quite a few of our major projects since that time. There's still a few projects in design that were originally prioritized. But if you look in the yellow section, we're at a point now where we really need to start making some decisions about how we'd like to prioritize additional projects moving forward. When Deb and I were talking, about how we could best make use of the planning committee's time and really start to put our minds to work on this topic, we've got a new set of organizational strategic goals. How do those strategic goals link up with our existing facility master plan? Now is the time for us to really start thinking about how these projects that we had identified as necessary future projects for us, how are those going to fit in with where we know our circumstances are right now and what our strategic focus needs to be. I bring your attention to things like the surgical service renovation project, the North Addition Phase 1. And if you look through the facilities master plan, the North Addition Phase 1, a big piece of what that entailed, although that's shown as a $30 to $50 million project, would be to relocate certain services that are currently in the hospital just to be able to do things like provide a swing space. We can't renovate the lab right now because there's nowhere to put the lab while the lab is being renovated. We can't do things like expand our physical therapy or infusion therapy spaces because there's nowhere to put that function while we're otherwise renovating those spaces. So the concept behind the North Addition was not just to create more space. It was to give us a place to put some of those functions while we were doing other necessary work for the hospital. The domino effect is going to be a challenge, but we are actively looking at, outside of projects that were originally prioritized, what are our options to try to find a space that we could move some of these functions to so that we can, for example, expand and renovate our surgical suite so that we can meet the needs of our strategy right now. So for today, this is really just giving a presentation on where we are, what was originally envisioned as what may come next. What you see in yellow, you can see on there's a numbered column about 3/4 of the way to the right on the screen. I listed those out because that's the way that the projects were identified as priorities when the facility master plan was identified. But otherwise, those yellow projects are in the order in which they showed up in the facility master plan. Only other thing I'd like to point out is at the bottom, I included a section called deprioritized projects. I don't want that to fall off our mindset though. It's the south side access. I know that's been talked about for a long time. it had otherwise been at a point where we were actually performing some design activity on that project. And we've elected, at least for now, not to pursue that. So it's still out there. It's something that we could, refocus our attention on if we chose to, but, I'd be happy to answer any questions that we have about this list. And I think it's a good place for us to start the discussion as we start to link up physical infrastructure prioritization with our strategic goals.
Hal,
Well, this is kind of an unimportant question, but up at the very top in the cancel budget, there was the physician call room, and I remember when we just were shot, got sticker shock and said, well, let's cancel that. But one of the real issues that had been brought up was that there was not a lock on the door. When the female physicians who would be using that room. Did that simple thing get fixed?
We definitely have a lock on the door. I don't remember that being an issue, but there's I can't get into that room. And I oversee facilities. I can't even go to, I have to get someone else to get me that.
So we've got way more important things to talk about, but I just want to check that on my list. Yeah, and I'm looking here at everything in yellow, and I'm trying to come up with an intelligent question, and I'm just kind of overwhelmed.
so a big chunk of our conversation is, and we've talked about it in this committee over the last couple of years. Linking is something that hadn't been done prior, is linking the strategic goals, that we've had several iterations of over the years to the master plan. And as we move forward with a number of the specific goals, there will be things that will be added and will potentially drop off of this list, but this is our introduction to the process. Ultimately, we'll ask staff and with input from this committee to see where the existing future projects fit within our operational goals, our operational strategic plan. And then as we add initiatives like the expansion of surgery and potentially adding additional services to our Bartlett suite of services, we'll prioritize these items moving forward. So this is really your introduction to the next steps as we're thinking about next year's budget, as we're working and as we're working moving forward with our operational strategic goals. So no action items today. This is just I would appreciate input from either or both of you as to the process. Or
the only thing that, occurs to me when I was reading this earlier is that if it's an area that is an income area, it should be supported first. So we're looking at the surgical suite. I would put that to the top because that would be my take on it. Is if you can invest some money into one of the areas that will then produce more income, that's what we should do. That would be my way of sorting.
I'm sure there are things though that don't necessarily produce income, but all of a sudden come up as urgent. And if we had an urgent parking problem, then we've got an urgent problem with that. I've heard complaints about parking, but I don't think that's a problem. But I think we need to think in terms of what generating revenue, and also just think of what kind of things come up urgently. And Nate's already discussed the need for swing space, which isn't something that's income, but that becomes an urgent problem if we're starting in on something that's going to involve swing space. So as I looked at this at home, I just saw parking. And I just kind of drew a little line in my mind through those and then thought, well, what about these other things? Anything that involves income is one thing, but anything that involves something that must be done in order to continue to function, that's got to go too.
Through the chair, I think one thing that we can do is, establish at the administration level some recommendations for just what we talked about. It gives us a way to start that next conversation. But I think it's also important for there to be understanding of what factors are we considering as we're making those types of prioritization recommendations. So I'm capturing a lot of those here. There's not one way to do it. They are likely going to be filtered both through what our strategic priorities are right now and our financial constraints, but I think that's something I can start working on. And like I said, my goal here was not to not be as transparent as possible about what's involved in these projects, but I also didn't want to reiterate the entire facility master plan. So I would encourage you, if you didn't get to participate in that process, or you haven't had a chance to read it, to understand, why some of these were prioritized at the time. Do those conditions still exist? How does that impact how we would want to move forward at this time?
Thank you.
I could just say, I think this is a very good shorthand way to put this up. So, not everybody in this committee has been around for them. But for me, this was a very good way to present the information. Quick, easily digestible way to understand.
Thank you. Any more questions or comments elsewhere? Okay. Let's move on to the next subject. Well, thanks. Trying to get back. Paul, I believe that is you. The Fuji.
Yes. So I can start and then I can hand it off to Paul. That's okay. So that is kind of the background issues. The planning committee is being asked to approve the implementation of a new PAC system, which is I apologize, my acronym spelling out there did not make it, which is a picture archiving and communication system for diagnostic imaging. And we're asking for it to be moved to the finance committee for approval and identify funding. The background is the imaging department's McKesson PAC system is no longer is upgraded and is now end of life. And so Cliff Hoban did a really intensive look at two different PAC systems and narrowed it down to two, which is Fujifilm and AFCA. That financial analysis is on, I believe, slide 13 of the decision point document that's attached to this. So basically what we're asking for is we need an updated service. The Nuvodia system, which was with Alaska Imaging Associates, who's partnering with Solarad. Their Nuvodia system and PAC system wasn't even kind of built yet to be able to support what we needed. And so they started looking at these different PAC systems and they looked at 10 different vendors. And then looked at the two viable options, which again were Fujifilm and ACFA, is that how you say it? And so what we're asking, Paul will give more information. It's also gone through the IT portion, so we know everything's compatible. And stakeholders were involved with it. And so once Paul and I'm happy to answer questions that I know, but Paul's definitely the subject matter expert on that. And then the IT piece for Chris for any of those. And then you're kind of done asking questions. We just asked that this be moved to the finance committee to identify funding. And then to do it full board after that.
You have anything to add, Paul, before I open it up for questions or? Slide 13.
As a summary, I would just say that the existing packs that we have now, we purchased in 2008. We've upgraded it as much as possible over its lifetime. The company was been several different companies in the past. It's being absorbed by larger companies.
It's changed multiple times. McKesson Healthcare, is turned into Change Healthcare. It was purchased by United Healthcare, and now they're going with the name Optimum or Optum. But you know, in February, they were hacked. We had to sever all our ties to that company. Because had to turn off the servers, so they, you know, the hackers could be coming backdoor into Bartlett Hospital. The only thing we could do with our current packs, if we were to continue with McKesson, would be to purchase another McKesson pack system. They have gone to a cloud-only version, which means that all of our images would be stored off-site and only accessible while we have an internet connection. What we propose is a hybrid solution that we would have storage here, and we could possibly have storage off-site so that we'd have a data recovery, and we always are concerned about the salmon dam or any other unnatural things happening here that could corrupt our data that we're required to keep for, you know, 10 years if you're an adult, 20 years if you're a pediatric patient. So we feel this is a better solution, and this packs that we're looking at with Fuji isn't just radiology, it incorporates cardiology. Pathology is still reading off the last slides right now. If they were to convert to a digital slide, then we could take that into the system. The image of OR, wound care, physical therapy, with links to the Meditech chart could be provided. If we have to store images for this new Da Vinci robot or not, I don't know, but they could be stored in here. Anything that's a DICOM could be stored in this VNA type environment. And, you know, as we're moving forward, there's more and more AI to assist with imaging. There's even AI for pathology slides. So the slides could go in there and you could be, you know, a second set of eyes, so to speak, reviewed on there. For radiology, there's so many things being added. And with that, we are adding, you know, CPT codes. So there's an opportunity for additional revenue and growth. In the new system.
I do want to mention, not specific to this project, but this is, I don't think that you've had a decision point document presented to any of the committees that we talked about at the last board meeting, the fact that with our initiatives going forward, that we'd be presented with a decision point document, and which is what we're looking at with regard to this PAC system question. So this is, we can expect going forward as projects come to its, the level of documentation that we're getting relating, that relates specifically. So.
Yeah, I just would say in relation to that, this demonstrates a very thorough analysis. I mean, I couldn't understand everything. In fact, maybe I will ask a question. With the AGFA, there's some charges, there's some costs in year 3, 4, and 5, and I just kind of wondered what that was about, but again, I want to make the point, this demonstrates a very thorough.
I believe that as additional hardware and the way they're licensed and service agreement.
So that's licensing.
And service agreement. Monitoring.
So anyway, I'm very pleased. I'm very pleased with this.
Just in ways background, this was the first major piece of equipment that we put through this process. So let me describe the process. The way to think about any piece of equipment, if it hits the net, it needs to go through the process to ensure that it's compatible with all of our systems, all our software. PACS is probably one of the most important systems we have in our hospital to be able to capture these images and see them over time. So Paul and his department was the guinea pig for our governance process that was established as one of our core key disciplines under the leadership of Chris Letterman and the staff that helped them do this. And that was a joint project with Kim, Chris, Paul, and I'm sure there's other folks, including Cliff, to pull this all together, go through it. Once it goes through that, we all feel comfortable that this is the right thing to do from an IT equipment standpoint, because this is one of those, you know, is it IT, is it equipment? Well, it's kind of both. It then goes to the plan and then goes to the finance committee. That's just one of the level of disciplines I hope the board will expect from us as we move forward.
And ideally, it won't be limited to just information services projects. It will be other points for which we as a organization and a board have to make decisions. Am I correct on that?
Yeah, there'll be stuff that has to go through this process that are below the scope that you want to look at.
Right.
But we still want to take a look at that because of the impact it could have, negative impact it could have on our systems if they were subject to any cybersecurity or other issues. So we have almost a zero scope level because of that issue, but in terms of your decision making, there'll be a higher scope level. But this is well within the size of this project is well within your scope level for your approval. And I think just from the standpoint of understanding how important PACS is to an organization, as Paul said, you know, we have to keep these images for a very, very long time, but it's very important in oncology. If we want to move forward and do more oncology, it's very important that other areas than just diagnostic imaging follow. So it's a key subsystem. I thought his staff and like on his name, Brendan, he's PACS administrator, sorry, did a lot of heavy lifting in terms of assessing this. What we did is to review that, make sure that we have all the bids available, go through the decision point document so we know what is the actual total all-in cost, total cost of operations, so that we can make an informed decision, not only the technical side, but also the financial side. So it was a really good project. And we will continue to do these things. So just some background.
Thank you.
Yeah, I don't want to do too much time, but I appreciated everything you said, but I also want to just point out, say on page 33, there's a flow chart that for the purposes of just giving this to the board, this made this much more understandable, put this in much better context. So I just want to say I really appreciated that too. I appreciated the board education aspects of this, because all these acronyms, they're kind of baffling to pull out and sort it out for me to understand. When I got to this slide, this was very useful as a board education moment.
One of the, just to brag on the diagnostic imaging, you can, and Paul didn't mention this, we're actually sending images out. So if a doctor who's a patient came here and needed to see that image, they can actually access that. I don't know if we send it or if they just look into it. That's a really good way of keeping our physicians that are independent a little bit more aligned with us. So there's some strategic moves here too. But that was there before I ever got here. So anything to add on to that, Paul?
Yes, on campus, our images are available to view in the electronic medical record and the text system. There's a little camera icon next to the report. So if you read about a cancer and you want to see the cancer, you just put the little camera icon that launches. That capability will be the same. We're also highly connected to every hospital that we refer to on a regular basis. Our PACS is connected to them directly. So one way or another, whether it's with our partners with Nuance or a direct connection with a VPN, which most places are going away from. You needed to go to Seattle, see a doctor at Virginia Mason with a push of a button, I can get your images to that clinic. I don't know if you've ever traveled out of town in the old days when we were still on film.
Yeah.
If you had your CTs with you, they were like this thick, and it's this big, and you'd have to, it's like an extra bag for traveling out of Alaska. Now it's just push a button and it goes. We've incorporated rapid AI for stroke analysis. If somebody comes into the hospital and you're worried about a stroke, they go through a stroke protocol. Those images are, while the patient is still in the CT scanner, the images are available to the Alaska Stroke Network. If it's a positive finding, a little app on your phone beeps with a little loud noise, the Dr. Nabridge gets it, the doctor here gets it, the radiologist gets it. Everybody knows right away that there's a bleed or a large vessel occlusion, and we can start making arrangements to transport or treat this patient while the patient's still in the tube. So, and this PACS is necessary to grow our future technologies like this.
Thanks. That was, great description. Any more questions?
Well, I'd just like to say that someone who doesn't need it on a cell phone, I mean, this sounds, this is great. I think we ought to move forward. And send it to the finance committee.
Yes,
If that's a motion.
that was just what I was gonna say. We do have a sample motion. Or a suggested motion, I should say. On page 7 of your packet. It's up there. It's right up there on screen. So if.
I thought I remembered.
There's the big words.
Oh, yeah. That's better. I move the planning committee and Bartlett Regional Hospital to approve the implementation of the Fuji PAC solution and move it to the finance committee for approval and identify funding.
Sure, so.
I have no objection, so let's move it forward to next week's finance committee.
Thank you.
Okay. Where are we at?
Thank you very much for having me.
Thanks, Paul.
Thanks, Paul, for all your hard work on this. And all your staff.
I will tell them.
We're at committee comments and questions. Okay, hearing and seeing none, I believe we are adjourned at about 12:53. Holy cow. Thank you all. We're scheduled, our next meeting is scheduled for June 7th. Does that still work for everyone?
When we talk about seamless integration of healthcare, it's one of the seamless things. It's just, we used to have to put CD discs on top of the patient, transfer it. Right now, it just goes right. And so as the patient goes, the information.
Good stuff.
Well, you can drag me kicking and